My audience, it's Laura Hart. I'm here with my colleague and my friend, Dr. David Sofer. How are you today, David?
I'm doing great. Thank you so much for having me, Laura. I'm excited to
Oh,
speak with you today.
it's great to have you. David is a physical therapist, and we're going to go into all of that in a minute. Just a few housekeeping things that I want to mention. Um, I apologize for my dog in the background. That will be taken care of in a second. Uh, that's doing these things at home have all sorts of interesting things. Okay, so I'm Laura Hart. I run a company called RoboFun, and we help kids do creative things with technology. And we have a studio on 102nd and Broadway where we run camps, classes, birthday parties, private lessons. Next week is the beginning of the spring semester, and that's after school. And we would love, if you've never tried us out, you may try your first class. If you like it, sign up for the whole thing. We prorate it for you. And we also do a lot of individual work with children, so that my whole thrust is to make sure that kids are learning, loving to learn, and that we use technology as the Trojan horse to help them feel empowered and engaged in their own learning. We are at 102nd and Broadway, and if you go to robofun.org, you can find out all about us. I put out a blog twice a week, which gives you information about raising children, about our programs, and about our special guests like David. So now I'm going to turn over, and we're going to talk about David. And David has an amazing, amazing past. He is a physical therapist. He is also a business owner, has sold one business so far, and is now starting a second. And he's here to talk to us in general about the things he's involved with, but specifically about if you have a child who may have an injury, how to manage movement in general and manage the whole PT process. So thank you, David, for coming.
Oh, my pleasure. Thanks so much.
So why don't we start with what you do? And, just like your rundown of your week is really interesting, what we were talking about a few minutes ago.
Yeah, so I like to put a lot of variety into my life. I get a little bored if I do the same thing over and over again. So primarily, I'm still a clinician at heart. I still treat patients. Throughout my whole business ownership, I've always treated patients. I want to continue treating patients. So 2 days of my week is solidly dedicated to patient care at my office in Brooklyn, New York.
And I can attest to that because I was emailing David about setting this up, and he's like, I can't do anything today. It's my patient day.
Patients all day. Patients all day. That's it. Hyper focus.
Yeah.
And then a couple days a week, I do some teaching at Downstate University and Touro College in their physical therapy programs.
Mm-hmm.
And then I've also recently just founded a new business called Arthritis Help, HELP. And it is a site designed to empower people by giving them the tools to manage their own arthritis pain on their own at home. I provide new videos every week for people, totally free, so they can kind of just check out what we do. And the inspiration for that for me was that I didn't find any resources online, honestly, that I was really happy with when it was coming to managing arthritis. I know we're talking about sports today, but I could talk about how I went from sports to arthritis at some point. And so I decided just to make my own. So it's much more beyond just stretches and strengthening, but really learning how to move, learning your movement habits, your movement patterns, and how to change the patterns that you have, so that way you can feel better. And ultimately, everyone always has the potential to improve from that perspective.
That's great. That's great. So before we talk specifically about children and injuries, especially sports, how did you get here? I found your story fascinating.
So, I was an athlete all growing up. I was a competitive gymnast, a soccer player, and then into college, I was a collegiate springboard diver, Division I. So injuries were always part of my life. And my mother happens to be an amazing physical therapist. So I was always kind of in and around me. So I certainly had that familial influence, or it's in the blood, as some may purport.
So So for example, like would you come home from middle school and say, "Oh man, I really hurt my knee," and blah blah blah?
Not it wasn't so dramatic, and they say like the cobbler's kids have no shoes. My mom wasn't aching to treat me when
Mhm.
she came home from a 10-hour day at the office.
Right, right.
So it was just, if something was really limiting, let's say I was doing gymnastics and I couldn't do what I wanted to do because my wrist was sore. I was fortunate, never I had one or two big injuries, but never to have anything super major. So it was more just like how to manage the things that come up, and she would apply a little treatment, and it was just kind of like watching her work and seeing how things work. And I also did a little work in her office as an aide through high school, so I got a lot of exposure through that. And then my goal coming out of school was to be a sports PT. I loved sports, and it was a great way to stay in the athletic world in a
Mhm,
professional capacity, since all
mhm.
of my dreams of being a professional athlete never really took flight. And that was great. And I spent a couple of years in a sports medicine clinic in Buffalo, where I graduated school, and I learned so much. And in that time, I was working with a lot of athletes, but I was also working with a lot of general regular folks, aches and pains. It wasn't a specific athlete program. And then over time, I started to realize that a lot of the things that I was doing with my athletes, I could also do with people in their 70s and 80s,
Right.
and maybe not to the same intensity. But when I started to break it down and really understand, the principles of movement are the same, regardless if you're jumping or running or getting out. If you're squatting 300 pounds or getting out of a chair, pretty much the mechanics should be pretty close to the same. It's just the intensity that changes. So I really started getting into movement analysis and understanding how people move. I studied a lot in the Feldenkrais Institute in 23rd Street here in Manhattan, where they do a lot of movement analysis type stuff. And I really started to find joy in bringing that to the older population, who I feel like is extremely underserved. Everybody likes to work with athletes. That's where all the glory is. But the old folks sometimes get the short shrift, I find. So I kind of geared my practice that way, but I still treat, anyone who comes to the office. So I treat my fair share of athletes as well still. That's
Sure.
pretty much my story, how I got here.
All right. So we have a lot of kids who come to RoboFun who are doing a lot of different things after school. RoboFun is only one of many.
Yeah.
And we have some who come in with parents who's like, no, got to leave early, got a PT. And so we started to talk, you and I, about children and sports, and you mentioned different some studies about athletics and injuries for children. I was just absolutely fascinated by this. Do you want to tell
Yeah.
us about that?
So there was this formerly, I suppose, conventional wisdom that if you wanted a child to be good at a sport, you just took them from the cradle to that sport, and they lived that sport singularly through their life, and so that way they would learn the fundamentals, and it would just become inherent to them. But um, uh, the more current research is showing that incidence of injuries are much lower in multi-sport athletes than in single sport athletes. So if you have a kid who wants to play baseball and get great at baseball, that's great, but let them play soccer, let them play basketball, let them play volleyball,
Right,
lacrosse, something else, because
right,
it turns out that variety breeds resiliency, especially from true at any age, but especially from a young age. And so when they're young and developing, they're developing the ability to handle anything that comes at them if they have all this variety, right? If they swim and run, I mean, that's such a varied skill set, as opposed to if you're always kind of focused down one track. When something deviates from whatever that kind of narrow scope is, you're more prone to injury. So it's not anything specific, but the key is to add as much athletic variety as you can. Obviously, safely and within the loads of the child's ability and age level and whatnot. Um,
sure.
Minus football. Football's got a whole fraud of stuff with subconcussive injuries. So I don't advocate for that, but all the other sports are
Right.
pretty good.
Right. When you're talking about this, I think about learning, and it's exactly the same with learning. You may have a kid that loves coding,
Hmm.
um, but it doesn't hurt to expose them to music lessons or to singing or, to drumming, or other things. We tend to get the kids who are not I think of RoboFun kids as smart and quirky and not in their bodies moving enough.
Uh-huh.
But all of these, it's the same with learning.
And that's not a coincidence, because in the end, it all happens in the brain, right? It's all brain training, right? All coordination and movement patterns and everything all happens at the brain level.
Mhm.
And so the type of training that I do with my athletes and with my older folks, non-athletes, is predominantly brain training that's expressed through the body, where you're doing brain training expressed through creativity, and problem solving. It's just a different type of problem solving. But the fact that, like, when I love treating clinical psychologists. I have a few on my schedule right now, and they're always like, "You say the same things I say to my patients." I was like, "Yeah, because it's all brain. It's all brain work." So it's always interesting how I find those things overlap, and mind, body, body, mind. You cannot pull them apart. Indistinguishable.
Yep, it's good. Very good point. Very, very interesting to hear. So as we're prepping for this, both David and I are kind of good at improv, and like coming to what hits us. And he mentioned this. I mentioned to him, I really struggle with posture and with how I sit in a chair. And he's like, yeah. It's not the chair. It's how you sit in it. I have a 5 minute. So you want to go through your 5 minute thing on chairs?
Absolutely.
How to sit in a chair, and I can actually make my image smaller and yours bigger if you want to be able to.
Oh, sure. It's all going to be inside your head. So just listen to my voice. It's not going to be so visually stunning.
Okay.
Yeah. So what I've been known to say a million times over, it's not what you do, it's how you do it. So people always ask me, is it okay if I do this? Is it okay if I run? Is it okay if I squat? Is it okay if I sit for an hour? I'm like, I don't know. It depends on how you do those things. So how you sit, we don't put much thought into how we sit, but if we want to take a moment and think about that. So if everybody's sitting right now, I just want you to kind of take a snapshot of yourself. Don't try to make yourself good. Don't try to impress me with your posture, right? Just notice how you're sitting. And I just want you to bring your mind's attention to the contact you're making with your chair, right? If it's a firmer chair, it's easy to see. If it's a softer couch, it's a little bit tougher. And I want you to feel that if you were to shrink down, right, and if you were to kind of slouch down, that your pelvis rolls backwards and you wind up sitting a little bit more on your tailbone. Okay. And then if you not go forward, but rise up, your back arches and your pelvis tips forward and you wind up rolling onto your sit bones, maybe the front of your sit bones. And if you do that back and forth a little bit, you can feel yourself roll from the back third of your sit bone to the front third of your sit bone. And you're just going to kind of just get a sense of what those sit bones feel like in your mind, the bones in your pelvis, the ones that are prominent in your backside that are contacting the chair. If you roll backwards and forwards a little bit, and then if you hone in on the center point, what feels like the dead center of your sit bones, that is your ultimate platform. That is where we were evolutionarily, biologically designed, created to really put force down. And then if I were to mimic the force of gravity, and I do this with my patients, I come and I take my hands and I put them on their head and I squish them down. When you're sitting on the center of those sit bones, your skeleton acts as a natural scaffolding and it disperses that force. You don't have to work for it. If you slouch down a little bit and I push on your head, or if you arch forward too much, some people do that, and I push, they feel that force kind of navigates its way through the body, creating stress and strain. So what I teach people, the simplest thing, whenever you're sitting and it comes to your mind, either that you feel like you're slouched, you feel a little bit of pain, find that center point in the sit bones, and then drive down into the chair a little bit through that to make yourself taller from the crown. And that is going to be your reset button. That's where you come back to. And just one more point about sitting. There's no perfect sitting posture. The goal is not to be in that position all the time. It's just not to be in a strenuous position all the time. So again, variety, getting back to variety, right? We don't want to be in one position all the time. So you find that reset, and guaranteed after 2 minutes, 30 seconds, sometimes you start to fall back into your habits. Once it comes back into your mind, just find the reset. And by wavering back and forth between stress and no stress, stress and no stress, your resiliency and longevity is much greater. If we just stay in that stress position continuously, pain or breakdown, whatever is going to occur. So that's was it 5 minutes? I think that's my 5 minute.
I think you even shortened it. That was fantastically helpful. So the other thing we talked about was that different injuries are prone to different sports often have different injuries.
Sure.
With kids, you want to talk a little bit about that?
Yeah, so different sports and different populations. So one of the more common injuries is ACL tears. Everybody is familiar with the ACL tear. ACL is a ligament in your knee. And
what is, just as a person interested in abbreviations to what
Yes.
is ACL?
ACL stands for anterior cruciate ligament. So
Okay.
anterior meaning it crosses in the front, cruciate, it's kind of got an X formation, and it's a ligament, which means it holds two bones together. And its job is to prevent the knee from doing this. So it holds the knee solid so it doesn't do this. So when the knee gets
The
into too much
knee
that
goes
position,
this way and not like
the knee is supposed to kind of bend this way, but it
okay.
also has some ability to turn on itself.
I see.
And that's prevented predominantly through that ligament and some muscles in the hip, actually, not even in the knee, or less so in the knee. And when that movement gets unchecked or too far, the ligament can't hold, the ligament tears. And one of the highest incidences of ACL tears occur in adolescent females in running or jumping sports, right? So females, 12 to about 15 in basketball, volleyball, soccer, have very high incidences of ACL tears for a couple of reasons. Females have a little bit of a wider pelvis for birthing, right? Just naturally. And it creates a steeper angle in the knees that we call the Q angle. So it makes the knees kind of angle in a little bit, which is a predisposition for ACL. It puts the ACL on greater strain.
I see.
Also, females in that age range tend to be less muscularly developed, so momentum has a little bit more control over them. So they're more prone. But there are lots of things that you can do from a prevention standpoint. There's certain strengthening exercises that you can do to kind of strengthen up some muscles in the butt, but it's more than that. It's really the coordination. And so it's really training people in a safe way, having them cut, doing cutting exercises back and forth, watching when they jump, when they land, do those knees buckle into each other or do they stay aligned over the toes? And if you can get kids to form good habits from a young age, in a lot of these ACL prevention programs that work on these types of things, or ACL tear prevention programs, they've seen decreased incidences going forward prospectively in people that go through their program. So it is possible to, you can't safeguard anything entirely, but it is possible to bring the risk level down.
So let's say I'm a mom of an 11-year-old who loves gymnastics, and I notice that there's something funky going on with their legs, and I'm making this all up.
Sure.
How would I find out about an ACL tear program?
So if you're looking for a prevention program, that would be, a Google search, can take you there. Or if you have in your area a place that is very sports physical therapy minded, that's what they specialize in. Most of the time they have non-rehabilitative prevention programs or sports performance programs that cover a lot of different sports. You'll find there are a lot more of those in kind of not New York City, suburban America, where they have a lot more space and they have turf and they have places to run, but there are a few in New York that you can find as well. But yeah, just look for ACL prevention, ACL tear prevention, or sports performance programs. They should have something in there, or just go to a PT who knows what they're doing, right, and understands sports, and they can at least give you some pointers that can really take you through that space and at least give you principles that you can work on your own.
Right. So I have an interesting comment that so I have a son who's gone through multiple surgeries, and everyone's always like, is he in PT? And his surgeon doesn't really believe in PT. And I mentioned this to a PT, and he's like, well, the quality of my field is so up and down that that's probably why your surgeon says that. But good PT is really good. So let's say somebody wants to know if they're getting good PT. I mean, I just do these things on a gut basis, but is there something, and I'm not trying to ask you to disparage your own field. But
no, I can tell you, just like anything else, there are definitely highs and lows, and there are also people who can both be good, but one can be more effective for you than somebody else. So sometimes it's just about finding the right fit for you. Physical therapy is often prescribed like a drug, like here, go to PT, as though it's this monolithic thing. But you go to 10 different PTs and you will get 10 different approaches. There is a lot of variance to the care. So sometimes it's about finding the right fit. Sometimes you just get somebody who's just not particularly good. So the first thing, I mean, there are a few things that are telltales that you can know right from the start. One is how much time do they spend with you, right? Especially on that first visit, right? The first visit, I mean, you should feel heard, you should feel understood, and they should be like analyzing you. They should be watching you, and it shouldn't be like this, read the diagnosis on the script, 3-minute conversation, go do these exercises, or worse yet, pawn you off to somebody else or nobody else sometimes, where you're unobserved, raise your leg 10 times and they go into the other room and then they come back when you're done. If it feels like you're not being watched, if you feel like you are not getting the benefit of somebody's professional expertise, then you're in the wrong place. You should feel like
you're doing exercises unobserved that you could be doing in your own living room. That's probably not somebody that you want to stick with.
And unfortunately, I hear it a heartbreaking amount from patients that wind up in my office that have gone other places. If the treatment is just get on this bike and then we'll give you a hot pack or a cold pack, again, if it feels uninspired, it is. If it feels like it's not thoughtful, if it feels like it's not professional, it is. If you're not having time with somebody with some credential after their name that knows what they're doing, and you're going off to some, aide or tech that has no formal education, they may be very smart, but that is not what you are looking for. That's not what you're paying for.
Right.
So those are the big, easy telltale signs. And then if you're getting all of that, then it's about finding the right fit, somebody whose approach matches what you need. And sometimes that's a person, their personal feelings or your worldview. And sometimes that's for what your body needs biologically. So, even good PT isn't always the right fit for everybody, and somebody else can do something a little bit different.
Sure. So I am thinking of all the people that I want to send to you, because everything you're saying sings. It's just like teaching, if your teacher just says, okay, go do that, and they walk away, or they don't check in really regularly with how you're working on something, there's something wrong.
Absolutely.
So if somebody is sitting at home with an injury and I want to go to Dr. David Sofer, what would they do?
If you want to, so you can come see me at my office. I guess I can give you the phone number if you wanted to call, 718-859-2626. And you asked for me or one of my colleagues.
So is there a name to the clinic?
So the practice is Motion Physical Therapy. So I don't own this practice anymore. I sold it to a larger company, but I still practice there. It's Motion Physical Therapy or Motion Sports Medicine, depending on what branch you're in. I'm in the Ditmas Park office, so you can find me there. And of course, that's the office I started, so things still run the way I ran them for the most part. So I'm pretty happy about that.
And give me the phone number one more time.
Sure. 718-859-2626. And if you can't get me, one of my colleagues there they're of the same mind. We're all kind of work together that way. But if you want to see me every week and see the movement training type of stuff that I do, that's on my website. That's Arthritis Help, HELP.info, INFO. And I have a whole library. Right now I've got 30 or so videos. That's geared towards adults, not towards the kids. It's not sports oriented, although I use, again, the same principles when I work with my athletes, and sometimes even the same exact activities. It's not all about intensity. So you can find my site there, and there's ways to contact me personally if you wanted to reach out to me through my site.
That's great. It's so interesting how all the principles are the same. From learning,
movement is movement, people are people, it doesn't change. Physics is physics. It gets applied equally no matter where we are.
Right. But to your body, and to learning about your body, to learning about how to learn in academics, it's all very similar.
It's, really, I come from a real pattern recognition perspective. So everything, all the movements that we do are based in patterns that our brain has pre-programmed from years of experiences. We do things the same way. When we get into the car, we buckle our seatbelt the same way. When we get in the shower, we tend to kind of soap up in all the same order, because it alleviates our brain from having to solve problems that aren't necessary. Yes. Sometimes we program in patterns that are not to our physical benefit, that create strain, and we don't know how to undo them because we've done them for so long. We can't even recognize them. So what I do is I have people learn to identify what their patterns are, figure out when the patterns become dysfunctional, and then learn how to change them and move them into a healthier, less strenuous way. But it's all pattern recognition. Then I just take it to a physical perspective, but you can certainly take it through any other non-physical perspective that you want to. That's your field, not my field, so I won't speak too much about that.
Well, it's so helpful. So my last question, which I'm totally springing on you, absolutely no warning,
Go for it.
which is just a fun one, is okay. We're maybe, knock on wood, I believe we may be coming to the end of a pandemic. Has anything in your life radically changed or wonderfully changed? Is there anything that's helped you get through this time?
Well, so one of the best things for me is that I since I am considered an essential worker, I've been going into the office even through the heart of the pandemic.
Wow.
We did scale down our patients to only critical care patients, like post-operative people that if they didn't get immediate care, they would have long-term dysfunction. And I volunteered to go in and be that person. And I think that was just really helpful for me. I didn't really recognize it at the time, but my routine, I was still waking up, I was still going to the office,
Yep.
and
Yep.
so all of that was good for me, and I think my mental health. But the idea of my site, this Arthritis Help, was really brought on by the pandemic because I was doing a lot of telehealth, a lot of things were going virtual, and so I
Yeah.
was really honing in my skills to be in a format where I could do it just like this, where I didn't have to be hands-on.
Right.
So that was great. And then I was like, you know what, I need to give this to more people. And so that's when I started putting things out on my site. And again, all free. If you want to go check it out, no charge, just to put it out there for people to have. So that really came from the pandemic as well. So from that, I suppose if we're looking for silver linings, I'm thankful that I was able to take something from that and hopefully turn into a net good for everyone else.
Right. So you sold one business and came up with the idea of a really cool business. And there's certainly a lot of us with arthritis. So
It's a big market. Yeah. So I did my research. It's like, what's a good market? I was like, arthritis. Everybody's got it.
right. So actually, one last question. When David and I attended a business development class together, and you had this idea of bringing PT people into health clubs. Do you remember
Yeah.
that?
Yeah, I do.
Where did
Um,
that go?
I never really ran with that. It didn't work out I still think it's a good idea.
It's a great
It
idea.
wasn't, it didn't light me up the way this does,
Sure.
honestly.
Sure.
So the logistics of it and all that, I actually really wanted to get out of the insurance space and the traditional models
Yes.
because to be honest, they were wearing me down a little bit.
Yep.
And so I still have my time in the clinic, but I really wanted to find a new avenue, and a way that I thought that I could really help more people than just beyond my own two hands. And so I think this satisfied me in that way more than that other project that I had. I wish I had thought of this back then, though. Who knows where I'd be right now?
Oh, I have no doubt. We'll come back to you in a year or two, and that site will have both free and paid, and I would guess, and just cool stuff for all of us. So.
I hope so. Yeah.
All right. Well, thank you so much. Again, I'm Laura Hart. If you're working on not physical but intellectual challenges for your kids, come check out RoboFun, robofun.org. And we have camps, classes for kids at 102nd. David, you want to put that not on the private chat, but on the other chat? And if you can't, I can do it.
If you could do that, that would be great. I don't think I have that.
All right. And I already have, but it's nice to end with it. So RoboFun is at 102nd and Broadway, and we have a mailing list. We let you know about our classes. Occasionally we have free classes and ways for kids to just come and try stuff. And we're happy to have these weekly, what we call our heart-to-hearts, my last name being Hart, to help my RoboFun family learn different things to help us enjoy our time on Earth. So just that little thing. So have a really great day, David, and thank you so much.
Thanks for having me. I appreciate it, Laura.